our beloved viewer, once again, welcome to Health Check, a program where we understand any sorts of illnesses regarding our health. And today, we are tackling the oral diseases, most especially to the people that we forget most because they are helpless. Those are the children, dental problems or issues in children. And I have an expert, a dentist, Brother Chivugu Hamidu, who was with us in the previous episode, just as you saw. Again today, he honored our invitation and is here again to help us or assist us understand or get rid of these oral problems. You're most welcome, brother.
Oh, thank you so much.
Today we're discussing oral problems in children or dental issues in children. And before we go to the topic of discussion today, we had a parent who had problems with his child, so he's giving us a story or narrating to us a story, what he came across in as far as the topic of discussion today is concerned, when it affected his child. Let's see what Brother Ahmed has to say.
Assalamu alaikum wa rahmatullahi wa barakatuh. Now, my question is that I have a child of something like 2 years and 3 months. Now, the problem was that when this child was still a baby, very young, his veins were not visible to the doctors. So they used to give us syrups. Now, at the end of the day, when we used those syrups for a long time, it somehow affected his these growing teeth, and they are somehow affected. They are not looking well. Now, when we consulted a doctor, we consulted a certain dental doctor, he said, don't touch those teeth. Now, I don't know what he meant by touching. And aren't these teeth treated? Won't the coming permanent teeth find the infection which will be transmitted to it from this milk teeth? So that is my question.
Oh, so sorry to your son, my brother. But the good news is I have Brother Chivugu Hamidu with me in the studios. He's going to help us understand. His problem is rotating. As I've heard, you'll help me or correct me. I stand to be corrected in case I go wrong. His problem is rotating around tooth decay.
Yeah.
So you're going to help us understand what really causes that in children, most especially.
Yeah. So thank you so much, my host, and also so sorry to our brother, the child. I believe it's not too late.
Went to
by the time
hospital,
we finish, by the time we finish,
medical treatment, different diseases, but it turned out to be something very terrible to the teeth of his son.
But I assure him, by the time we finish this program, he will be at peace and
Let's
happy.
pray.
The child will get fine.
Okay.
So, dental decay in children is not any different from dental decay in adults. Decay is decay, okay? And the factors, the major factors that we look at, they are basically we call it cardiogenic microbes, okay, or bacteria. Those are microorganisms that cause decay, okay, because we have very many microorganisms that, not that every microorganism causes decay, okay? So those microorganisms have to be there in any decay of any sort, be it in children or in adults.
Okay.
Then it can be, we have time is also another factor. Okay, how long does this food is in contact with the tooth? Okay, then we have fermentable carbohydrates or sugars. Okay, so it's another factor.
So these are the causes that you explained.
The factors that decay wherever in a child or in an adult. Okay, and the last factor is the tooth itself, because if at all the tooth is not there, what will get infected? I normally throw a light moment with my patients that if I told you are tired of these diseases, tooth diseases, either remove all the teeth or do away with eating, because
how will they smile then?
you'll have solved all the problem, because if at all a tooth is not there, what will get infected?
But again, there comes a problem of smiling. How is he going to solve that?
There you have to adhere to our devices.
Okay. So they better sit comfortably and listen to
globally, dental, we call them decay in children, and that type that our brother is talking about has many names. The general name is early childhood caries, okay?
Early
or decay.
Childhood caries.
ECC, yes. So we are looking at any decay of any form in children. Now we have, but they are also called baby bottle caries, or night bottle caries, or nursing caries is decay.
Yes,
okay,
that would be quite understandable.
Baby bottle decay, nursing decay, night bottle decay, okay, breastfeeding decay, okay. So those are the common names we use to term, and it has two characters. Okay, one, early onset, okay? Because they start as soon as the tooth erupts in the mouth. Two, rapid progression, okay? Within 6 months, the tooth is affected, okay? Another thing, they normally affect smooth surfaces that are not associated, because now when I go to my friend here, when you look at this teeth, this tooth, it has these features, we call them fissures or grooves, those depressions.
Those curves
yes,
inside the teeth.
Everyone has them on their teeth, okay? They are not so pronounced in children's teeth, okay? And yeah, but those features, they tend to, you talked of fermentable sugars. When sugars are fermented, acids are produced, okay? So these acids are the one that stagnate in these fissures, and decay starts in normal caries. But now, in children, we normally see decay, decay starting near the gum.
Yeah, we'll have those pictures
on
as
smooth surfaces,
yes.
okay, which cannot facilitate stagnation of acids, okay, not in the middle or in the middle of the teeth, okay. So we are seeing them on smooth surfaces, okay, and more on these anterior teeth.
Yes.
But they can spread to the molars, upper, okay. They are more on the upper, then on the lower molars, then less commonly seen on the anteriors. Why? Because as a child is feeding, the tongue is protecting these anterior teeth, okay? So the tongue is around here and is protecting these teeth. That's why they can only get affected when it is really so bad. Actually, another term that we use is rampant decay. Rampant decay. Yeah. So they are the most common dental condition in children of school aging, going age. Okay, yeah. So very few you can find when they don't have that issue. Okay. But decay is decay, whether it is this rampant or any decay, because we can even find just decay in children's teeth. Okay, yeah. But this one is more pronounced. Now, after some times, this decay forms. It can change some color. It can get some yellowish or brownish, or even can get black. Okay, you find a kid with black teeth all throughout. Okay, yeah. So those are that's how you notice that, oh, these are baby bottle decay.
Okay.
So really, they are so inconveniencing, and it's a common problem. Another thing that's associated with them is now our brother, the kid, noted that was falling sick a lot, okay, and was using syrups a lot, okay,
Yes.
and syrups are concentrated sugars, as you know, okay. So, and we are talking of fermentation of sugars. So when you take in those sugars and you don't remove them, okay, they will get fermented. A lot of acids will be poured in the mouth, okay, and we shall see a rapid progression, okay, of this infection. Now, some teeth have a malformed, okay. You can find that one way or another, a mother can have an infection that affects the development of the child's teeth. Because, by the way, teeth, they develop when a child is still inside the womb, okay? So when they are born, what's remaining is just maturation and maybe calcification. But their shape, they are formed when the child is still we call it intrauterine, okay? So whatever the mom does, whatever the mom eats, okay, will also impact, okay, the child. Now, there's some medication like tetracycline. If at all a mother takes tetracycline when they are still, when they are pregnant, okay, this child will be born with stained teeth.
Oh.
Yes, they will have brown streaks, okay? So, if at all you take tetracycline, even tetracycline, giving them in children, okay, they'll come up with brown streaks, okay, on teeth. So, if at all this child is having such malformations, okay, and now is subjected to these factors, okay, increased acid production, okay, we shall see that these teeth will get infected at an early stage. Now, mothers tend to think, parents tend to think that if at all a child is not eating solid food, okay, there's no problem. Breast milk is breast milk, okay?
Yes.
But to help them, you have to start taking care of these teeth so long as the tooth emerges in the mouth. Your baby with one tooth, please start taking care of it.
Oh.
Okay?
But before, when we were still in schools, they used to tell us that it is good for a child to start brushing at the age of at least 6.
Now, this what I told you. By the way, I think we hinted on it in our previous program.
Yes.
That dental patients, the first people they go to consult are not actually professionals. They don't come to us. They first consult the people.
So you mean a 2-year-old child should
not
have a toothbrush?
Old child, my brother, a 6-month child with that one tooth I'm talking about. This child is eating. We are talking about early childhood decay, okay, which you've said that it has an early onset.
We are told a child at that age, you know, they don't know how to use those toothbrush, so it will affect
They
their
don't
gum.
know, but you know. You get it? You know. And the child doesn't know that when I don't brush, such and such will happen. But you know as a parent.
And you can assist them on how to use it.
Now, this is the challenge now we are facing. Now, a child hasn't seen you even touching their mouth. They clock 6, 4, 3, you start fighting with this child. This child doesn't want to brush. I tell them to brush. They don't want to brush.
You know, we relax because normally children at that age do not smell their mouth.
Nurturing is key. So when a child develops their first teeth, whenever you breastfeed these teeth, get a clean, damp cloth, okay? Wipe around their teeth. When you do it for a year, this child knows that mommy always touches my tooth. Doesn't know the reason, but they know. When they start understanding, they'll even ask you, mommy, today you haven't.
And actually, they themselves will start mimicking.
Good. They will see you. We are in an era when parents say some people don't brush and they expect children to brush. So
funny.
That's where it all starts. When a child develops their tooth, start caring for it right away. Okay? Yeah. Now, after that, we know that these caries, our brother was saying that, anyway, we shall bring it, but I was told that, hey, don't tamper with those teeth.
Don't dare.
Don't dare tamper with them. And for them, they relaxed. They used not to touch them. Even cleaning was not done. You get? So, if at all an infection has already set in, remember when these teeth start to get decayed, there is more deposition of dental plaque.
So someone told them they should not tamper with the kids' teeth, but did not give them the option who should tamper.
Good.
Because at least maybe they did not have any expertise to do that.
Yeah.
But
But still, tampering was not removing them. Because as we discussed earlier, when someone thinks of going to the dentist, the only thing they used to know is removing. Okay? Now, I'm feeling the pain of my brother. Okay? They told him, you shouldn't tamper with the teeth. The child is suffering. Okay? So, they just told them not to extract them. Because this child was young. Okay? And these teeth have a role to play. Okay? One, aesthetics, beauty. Okay? But now, okay, the beauty thing is no longer there. Okay? But if at all the teeth are healthy, they are beautiful. These kids' smiles are beautiful. Okay? Now, the primary role is eating. Okay? Now this child is no longer eating well. They are going to get malnourished, okay? And their growth rate is going to come down.
Actually, the child needs more eating than you, the adult.
Yes.
Because as we grow up, we are advised to reduce on food. Yes, they are advised to eat more.
Perfect. Now also, this child is not free with their peers, okay? They laugh at them, okay? It is even worse. It's so taunting and traumatizing that some don't want to share it with them. Yes. Okay? So it is psychological torturing. Okay? Now, another thing which is more important to me as a dentist, these teeth, they preserve spaces for their permanent counterparts. Okay? So when you remove it early enough,
the better.
No. When you remove it early enough, teeth move. When there is space in the mouth, they will move. Okay? So their space will be taken up. By the time they grow, we shall see crowding and malalignments. That's one of the most cause of malalignments, early extraction of permanent teeth. Okay? So because of those reasons, this person probably was a dentist, told them, don't tamper with those teeth because of those uses. But he didn't refuse them to clean them well.
So there is a possibility that they might have misunderstood the doctor.
Good. They didn't. Okay? So I think it was just clean them normally, okay?
But don't
or
think
do
of
any other treatment,
them.
But don't remove them because of the reasons we've seen. Okay? Yeah.
Okay.
Now, basically what causes them, starting from then, baby bottle carries. Okay, normally, let's start with baby bottles. Okay, some people express the milk and put it in the bottles. Okay, but some they don't. Okay, they have to get other fluids, juices, and whatever. Okay, to supplement or to feed the child. Okay, now the mistake they do is to do it at night. Okay, and they frequently do it continuously. Okay, that at night, I've had some mothers say, my baby sleeps on the breast as they are, oh, bring that baby, I breastfeed it and it sleeps. So that's not so much a good practice, because when at night or when you are asleep, there is reduced saliva flow in the mouth, and saliva has 4 basic roles it plays. One, it is a cleansing effect. Okay, that as it flows, when you've just eaten, when you've just taken a soda, a few minutes, you still feel it sweet in the mouth. But as time goes, you stop feeling it, the sweetness.
Saliva has
Why?
played its mind.
Saliva has washed away everything. Okay, so that's one.
So it's a cleanser.
Cleanser. 2, its pH is alkaline. Okay? We talked of fermentable sugars, that when they are fermented, acids are produced. Now, this saliva comes in to neutralize these acids. Okay? So that's another role of saliva. 3, components of saliva, it keeps on trapping ions that go through the mouth, like fluorides, especially calcium and others. Okay, now these fluorides, they help in the early stages of decay. Actually, the black, when very many people, if you open and look into your eyes, your teeth, in those crack-like features, there is black, you see black forming in them. So that black is a complex that is called a hydrofluorocomplex. Okay, it is formed that the tooth was starting to decay, had lost its minerals. Now these fluorides were there, they replaced their lost minerals. Okay, and they formed that black complex. Okay, so it is from saliva that these minerals, okay, will come from and help seal off those early decays. And the process will be as we've seen.
Okay.
Yeah.
Thank you so much, Brother Dr. Chibugu Hamid, for such a wonderful enlightenment. By now, parents, you know what really causes these decays. Just be very sensitive when it comes to the medicines that you give your children, most especially the syrups. And for the mothers, doctor said, from the womb of their mothers, children can get such oral issues or problems depending on what you eat. So mind what you eat or what you feed your children. Doctor, the question that might be the last one, who is at a greater risk?
These are young children, first of all, okay? Ages between 2, because by 2 years you have all your primary dentition formed, yes. To 5.5 years, okay? So those children are at great risk. Now another person who's at great risk are those ones that we've talked about that use those baby bottle carriers, okay? Also children to mothers who are thought to be of a good, who come from a good socioeconomic status. But I will look at it, because when you look at socioeconomic status, these children can afford every treatment, okay? But these mothers, they work a lot, full-time jobs, okay?
Have less time for their children.
They have less time. As compared to housewives, okay? there was a research that those they are more at risk. Also from poor economic status, okay, poverty, okay. Someone cannot afford a treatment. Others cannot afford just a toothbrush.
Yes.
In the past, someone didn't even see a toothbrush when they are growing.
Till now,
okay?
people still suffer.
So,
people can't afford toothbrush.
if at all someone is poor to that, okay, they are at risk, okay? Even those, like our brother, those people with the poor immune response, okay? Those who often fall sick, really they'll use syrups and they'll have decay. And also, since we have a problem, immune compromise, there will not be protection that offered by the IGA that we talked of. So those are the people at more risk. But now, if at all they've formed, we've seen these caries have formed, really what do we do? Okay, do you have to leave the child suffer? No. Okay, they have to eat, they have to talk, they have to smile, they have to do to be healthy, okay, and to feel good in their locality. So what we do, I can just remove the top pulp, then cement the tooth, and the child will thrive again.
Okay. Yeah. Thank you so much, Dr. Chibugu Hamidu. It has been an honor having you with me here to help our viewer understand how to overcome their oral issues or problems, most especially in children, as the topic of discussion was today. Honestly, I would like to have more enlightenment regarding several or different diseases regarding children, but time can't push us there. So we can come back next time. I promise you that, inshallah, we'll have more programs here, same time, same day. Just stay tuned in, because more faith-inspiring programs are still coming. But for now, we'll put a stop on our program. And until we meet next time, assalamu alaikum wa rahmatullahi wa barakatuh.